Hello, welcome back to our new session. In this class we will be studying regarding the bone called clavicle. So before going to that, we have to study few names like anterior, posterior, some terminologies are there. So we will focus on that first today. After that we will go to the part called or the bone called clavicle. So consider this as the midline, or consider this as the sternum, a bone called sternum. There is a breastbone also, you will say. It is coming the middle part of the body, and this is the left side and this is the right side. This is the head and this is the toe. So if you are considering this as a bone or considering this as an object, so this is a sternum and same thing will be here, so it will be like this. Okay, so consider this as a sternum and this as a body, one part of the body or one part of the object or organ. So and this is the right side and this is the left side. So whatever coming close to this medial part, this is the midline of the body. So it is near to the midline, so this part is called as the medial part. That is the medial part. And whatever comes away from this one, if it is in the here, this part is called as the lateral part. So away from the midline it is lateral part, and close to the mid part it is the medial part. So away it is called as lateral part. And the front side, this front side, that is known as the anterior part. Anteriorly, we will be speaking anteriorly, that is the front. Middle is close to the midline, and away from midline, that is the lateral part. So this is the midline of sternum or the midline of the body. This is the medial part, this is the lateral part, and the front side is called as anterior. And same way the back side, this side we will calling as a posterior side. The back side. So front is anterior, back is posterior. Close to the midline it is the medial part, away from the part it is the lateral part. In the same way the top one, that we call as superiorly. So we will be talking as medially, laterally, or anteriorly. So anteriorly is the front side, this one. Anteriorly, if anything is there here, we will say anterior to this object, one object is here. Anteriorly. Medially means like this. Laterally, if we speak superiorly, some object is there means superiorly, above. This top part is called superior. And the same way inferior, downside. So this terminology part we will be dealing as a separate class only. To understand this clavicle, we need not only clavicle to study this bone or any organ, we need that one. We will be dealing that in the next section, this terminology part in the next section. So for knowing this one, I just explained here, that is the medially, laterally, anteriorly, and this is the posteriorly. Top one is the superior and down one is the inferior. This we want to know in this session. So now 10 to 15% is finished. If you know the terminology like superior, inferior, medial, lateral, if that terminology is okay, 15% of the class is over. Okay, so this is a clavicle bone. You just consider this as a clavicle bone. Okay, it is not exact picture of the clavicle bone, but just consider this as a clavicle bone. Okay, this is also called as collar bones. So clavicle bones, side by I will give the photos also if possible, just you can correlate with that one. Okay, so this is the right clavicle. right clavicle, and this one is a superior aspect. I had told superiorly. So above, if we see from top, how is the view? Superior aspect of the clavicle, right clavicle, superior aspect, and this is the medial. So here sternum is there, consider here sternum is there. If we are, this is a sternum, I had told this is the midline or this is the medial part. So whatever near to the middle part will be called as the medial side or medial part. Away from it will be called as a lateral part. Okay, and the front side, so from the superior aspect we are seeing, front side which we will be seeing is anterior, and here it will be posterior. So considering this as a clavicle bone and this is a sternum, this is the middle part, this is a right clavicle, so this is the middle part. So this portion whatever we will be calling as the medial, here we will be calling as the lateral. So we are seeing the superior aspect, so the front side will be the anterior and back side will be the posterior part. So clavicle is a long bone. First of all I will say clavicle is a long bone. So this bone supports our shoulder, so it is located in the shoulder area only. As I had told in the parts of the upper limb, this is coming there only, clavicle and scapula, it is coming as a bone in the shoulder region, clavicle and scapula is coming. And also in joint part we had discussed two joints in the shoulder region, that is the sternoclavicular and acromioclavicular. Acromioclavicular. Sternoclavicular, the name only suggests sternum, that is the breastbone or the medial side. This is sternum is a bone, we will be studying in the next session. So sternum and clavicle making sternoclavicular, acromioclavicular, clavicle and the acromion process that we will see. This joint we have studied in the shoulder region, two bones we have studied, that is one is the clavicle and one is the scapula. Okay, so this we have studied in the shoulder region. So this clavicle, this is a long bone that supports our shoulder so that our arm can swing freely. Okay, this is a bone that supports our shoulder, which helps in the movement of our arms, that also freely away from the trunk. So here three parts are there. This part is called as a shaft, we will say as a shaft. Okay, and two ends are there. So this end I have told it is near to the midline, so it is also called as the medial end. Shaft is a middle part, this is the medial end, and away from the sternum, away from the midline is the lateral, so it is called as a lateral end. Three parts are there of the clavicle. This is near to the midline, medial end, coming the cylindrical, that is shaft, and lateral is the lateral end. The shaft is a cylindrical part. So let's see. So let's see the shaft first. This portion, middle portion. Okay, that shaft is been divided into lateral 1/3 area. So lateral 1/3 and medial 2/3. So you will see lateral 1/3 is of the shaft. When we divide the shaft 3/3, so when we divide it into one part of the shaft, that is the lateral part, and medial it is two part of the shaft is the medial 2/3 medial part when divide the shaft. So the lateral part The lateral 1/3 of the shaft is flattened above downwards, and it also has the two borders. That is, I had told two borders are there. We are seeing from the superior, from the above we are seeing. So it has two borders, that is the anterior border and the posterior border. Two borders are there. Anterior border is there, lateral part, and posterior border is there. Anterior border is concave. So you can see here the anterior border is concave forward, and the posterior border is little bit convex backward. And the same way, this portion also have two surfaces. So lateral 1/3 have two borders, that is the anterior border and posterior border. So anterior border is concave forward and posterior is convex backward, and two surfaces they are having. The first one is the superior and second one is inferior surfaces. One is superior surface and one is the inferior surface. In the inferior surface they have, so we are seeing from the superior part, so there is a superior surface, and inferior surface there present one conoid, tubercle is there. So inferior part comes like this. It is rough in the medial side, it is rough. So considering this as the inferior aspect of the same right clavicle. So right clavicle superior aspect for this one will come with from the downside. From the upper side is this, from downside if we see, it will be same, inferior aspect will be like this. So I had told that the inferior surface is having an elevation called as a conoid. An elevation is there called as conoid tubercle. So this is the conoid tubercle. This is the inferior surface. It is present in the inferior surface. So inferior surface present an elevation that is called as a conoid tubercle, and the ridge called as a trapezoid ridge. So one ridge is here, this is the ridge, that is the ridge. So it is called as trapezoid ridge. So this is the inferior shaft, inferior aspect of the shaft. Okay. And similarly I will show one thing, that is one ligament is here in the inferior aspect, that is costoclavicular ligament, and we will see here one groove, subclavius groove we will see here. So it is a subclavius groove. So first we have studied the terminologies: superior, inferior, medial, lateral, anterior and posterior. When we see the clavicle, it is a long bone. So being the long bone, so we can divide this into two ends, that is medial end and lateral end, and coming the shaft is the middle part. So when we see in the shaft, we divide it into two, that is the medial 2/3 and lateral 1/3. It has two borders, that is the anterior and posterior. So anterior border is a concaveness is there, concave in the concave forward, and here convex backward. Two surfaces are again inferior surface and superior surface. Superior surface is subcutaneous and inferior surface I had told. One tubercle is there, that is the conoid tubercle, and one ridge is a trapezoid ridge present. Same way, one groove, that is subclavius groove is there. This much we had seen until now. Now next joint they will make, that we will see in the coming. So now we know the medial end as well as the lateral end of this bone. So this is called as the medial end and this is the lateral end. So lateral end is also known as the acromial end. Lateral end of the clavicle bone, it is also known as acromial end, and medial end of this bone is known as the sternal end. Sternal end. As it is close to the bone called sternum, it is called a sternal end. And acromion process is there. The scapula is one of the bone which we will discuss after this one. So it have a process called acromion process. So it is attached to here. So it is called as the acromial end. Lateral end is called as the acromial end. And we had discussed, while discussing the parts of the upper limb, two joints in the shoulder region, that is the sternoclavicular joint. So this is the sternum and this is the sternal end of the clavicle. So here it makes the first one, that is the sternoclavicular joint. So the medial or the sternal end, that is quadrangular, and it associates with the clavicular notch of the manubrium sternum. So in sternum one notch is there where this clavicle goes and sit. So there it makes the joint called sternoclavicular joint. And next the lateral end, that is also known as the acromial end, that is flattened from above downward, and it also bears a facet that articulate with the acromion process. I had told one acromion process is there. Acromion process is there of scapula. So it makes the joint called acromioclavicular joint. It is very easy. In the medial end, it is close to the sternum bone. So it is known as the sternal end, and the lateral end is close to the acromion process. It is known as the acromial end. So acromion and clavicle, this makes the acromioclavicular end as sternum, and the middle end there is the sternum, and the clavicle makes sternoclavicular end joint. So mainly two joints of the shoulder region, there is a sternoclavicular joint and acromioclavicular joint. Next we will see the side determination, how we will know which side, how the position, what is the position of that clavicle. So generally the medial end will be large and it is quadrangular. The medial end will be large and quadrangular. And the lateral end is flat. The lateral end will be flat. And the concavity and convexity also you can see. The shaft is slightly curved so that it's convex forward in its medial 2/3 and concave forward in the lateral 1/3. We had told that this part is the lateral side and it is concave forward. And lateral 1/3 above, it is convex backward. That is one of the thing you can see. And the inferior surface is grooved longitudinally. So we told that superior surface is there and inferior surface is here, and we had discussed the inferior surface, one groove is here. If you watch that groove, that also you can see in the middle 1/3 part, you can see one groove is here. So this were the some of the side determination part. If you have any of the doubts, you can just comment in the comment box. So, and also go and cross check with your references, and if any doubt is there, if anything you didn't understand, just you can have a query out there, especially for the students of the BAMS. Thank you for watching this video. We will continue remaining in the next coming session. Thank you.